Hey guys, it's Dr. Emer. We're out of the operating room and into the clinic, and we're doing one of our favorite treatments today, acne scar improvement. What's important about this case is he has a darker skin type, and it's very important when you're treating patients of ethnicities or mixed ethnicities or higher risk for hyperpigmentation, like my patient today. You prep the skin before you do any laser treatments, and you be conservative with your treatments. I know it's unfortunate for the patients because it takes more times to see improvement, and for him especially, he has some deep scarring in the temple that's going to take us a little bit of time to get improvement there, but we're going to work on that process and start with a stronger combination. So today, first what we're going to do is improve some of his overall cosmetic look, give him a little bit of volume to the mid-face because it also makes the scars more noticeable when there's lost volume, and then we're going to go into phase 2, where we do a combination of lasers, TC, cross, and filler for the scars. So turn to me a second. I'm just going to show everybody here. Very structured jawline, and he's a strong face, but he's more narrow, or is more hollow in this mid face here, which is making his tear trough become more evident. So smile again as big as you can. Good. So we're going to do an injection here. Deep breath. Good. And we're using Radiesse, which is a calcium-based filler. The reason I actually like this for him and for men is they get more collagen production, and it gives a lot more lift. Like, look at that already. You can see it was a big improvement in his overall volume. We're not doing a lot. We're doing enough just to lift the mid-face for him so that he gets volumization here so that his under eye looks better, you know? And he's gonna feel a little numb from that too. So go ahead and hold him there. I'll do this. Gauze right there. Now we're going to go to the other side in a second. How was that terrible with pain? Or are you okay?
I'm okay.
Okay, you did really good because I know you're nervous, so I just want to make sure everyone understands that it's not too bad. But in general, what we're doing is we're only using a syringe just to give him, smile again, we're seeing where his cheek should be up here, so we're going directly down to the bone. I do a little tapping so it doesn't feel as bad. And for men especially, you don't want to go laterally with the filler. You really want to just utilize the filler to lift. So we're doing the superior medial portions of the cheek area. Good.
How long does this filler last?
So this one lasts, if you look at the clinical trials that I actually did when I was a fellow, it lasts about 12 to 18 months. So he's going to get a lot more improvement there. And then the last one, we're going to get right down to the bone. Perfect to give him. Good. Okay, come hold right there for him. Great. So now we're going to go back, because we got a little volume now, to lift the mid-face, and we're going to do a softer filler to his under-eye area. So this one we're going to use Restylane. What I'm going to do here, let me set this up.
Which Restylane are you going to use?
We're going to use Refine, which is a softer Restylane, and this is going to help just sort of soften out his under eye. So you're going to go to the other side. I got this side, you go to the other. Good. And what we're going to do is we're going to use a cannula for this because there's a lot of blood vessels under there, and this will help us prevent bruising and swelling, and men tend to want to bleed a little bit more. Cannulas are a little bit harder in men. You're going to feel a weird sensation. You can see where the cannula is, nice and deep in the tear trough. And we're just going to go nice and slow, using a 27 gauge cannula, very low risk to him. Now the thing with him is because his mid-face is so low volume, he really is a candidate for like an implant or a lift there, even though he's young. So our expectation should be improvement the most that we can. If we go too high with this filler, he's going to look swollen and unnatural. So we'll see how much we get. He probably needs even more filler than this, but this is a good starting point. You could always do eyelid surgery. You could always add an implant. But here we are with the cannula right in the eye and feeling where the cannula tip is right there. Okay, I'm going nice and deep. I'm focusing on his middle tear trough because that's what bothers him. Refine's really soft. We like this filler to honey because it moves with you. It sticks to the skin. It sticks to the area. So it's mobile. It doesn't clump or lump, which is a very natural look. Good. See the cannula?
It looks so good, yeah. Can you show us the cannula when you take it out?
Yep, show you right now. Good.
Wow, it looks really,
So
really good.
now it's better, so you can
Yeah.
see that there's improvement there. And again, we're just looking for improvement, so you're gonna switch
Let's see
sides
how-
with me now. Try to handle that, go ahead, pressure on that side. Perfect. So I'm gonna come over here, do that same thing through this lateral approach, lateral medial approach. See this side, he always wants to bleed. He's bleeding already before too. We're going to
Sorry.
go right up into that tear trough and just slowly inject some of the filler. Nice and slow, very focused. Doing nice little threads.
You could see it already. It looks really good.
Nothing's perfect, so I always tell people, look, what you want to do is develop relationships with your cosmetic doctor. If something doesn't look right or it's not what you wanted, you just go back and you discuss it and you fix it. Fillers can be reversed if you don't like them in general. There's a lot we can do. Sometimes you don't know how someone's body's going to react. Everybody reacts differently to fillers. Perfect. Hold right there. Great. So at least now we got a nice improvement. Why don't we just at least show him so he can see. Go ahead and grab the mirror. You're done with the needle. I got that. We'll show him real quick and then we'll come back later. Let me see. Smile. Good.
Nice.
Yeah, and then what we would do is now that we've built the mid face here, we can go even higher later and do more. But if you take a look, go ahead and look in there. Smile as big as you can. Right now you're going to look a little swollen because we moved the cannula, but the goal was to lift this up so that it blocks more of the trough. So now it's better, and over the next 2 weeks it will build and improve that area.
Okay.
All right, so that's fillers for the mid face, guys. Take care. So what I want her to do is